Congratulations! You've just had your fast-track procedure and are now receiving transtracheal oxygen. Transtracheal oxygen is the most efficient form of oxygen therapy currently available for oxygen-dependent patients. You should begin to feel the effects almost immediately. In order to get the maximum benefit of your scoop catheter, it is very important that you follow the cleaning procedures that have been established since 1986 to make sure your scoop is functioning optimally at all times. A team of physicians, respiratory therapists, and nurses will be monitoring your transtracheal tract as it heals over the next few weeks. Because you've had the fast-track procedure, your transtracheal tract will heal much quicker, as your surgeon has created or fashioned the tract for you. Typically, the tract is fully mature, that is, healed in 2 to 3 weeks. This may vary somewhat from patient to patient in patients of color, patients with diabetes, and patients receiving certain medications, such as high doses of prednisone. You will be brought in for several scheduled post-operative visits. At that time, a respiratory therapist or nurse will remove your catheter over a wire guide, clean it, and reinsert it for you. It is important to remember that while your tract is healing, your catheter must stay in your windpipe. In a few weeks, when your tract is completely healed, you will be taught how to remove your catheter once or twice daily for cleaning. Cleaning your catheter in place is the hallmark of catheter care during this period of time. Cleaning in place is easy, and virtually all patients become proficient in this technique in a very short period of time. You may have a spouse or other family member help you if necessary if you have visual or dexterity problems. To clean your catheter in place, it is always best to assemble the supplies you will need beforehand. These include your nasal cannula, cleaning rod, some Q-tips, and a can of normal saline solution. Regular cleaning of your scoop catheter in place will ensure proper functioning while your tract is healing. Cleaning is normally begun on a twice-per-day schedule, but may be changed to cleaning 4 times per day based on your individual signs and symptoms. Every time you clean your scoop catheter, you must use your nasal cannula while you are cleaning. Always arrange your nasal cannula to arrive from behind at your prescribed nasal cannula flow rate, so it is not in your way. Position yourself near a sink and mirror with good lighting. Wash your hands with soap and warm water. Use a Q-tip and water to clean any mucus crust from the skin around the catheter. Never use any creams, lotions, or ointments around your tract. Blot the area dry with tissues. Wash the cleaning rod with antibacterial soap and rinse it well to remove all soap residue. Dry with a tissue or paper towel. Be careful not to stretch out the very end of the cleaning rod. Disconnect the catheter from the scoop oxygen hose and instill 2 squirts of normal saline solution. Each squirt is only 1 cc, so you will be instilling a total of 2 cc's of saline directly into the catheter. The squirt may well cause you to cough. This is normal, and in most patients will get better over time. Run the cleaning rod down the inside of the catheter 3 times, all the way down to the green handle that prevents it from going any further. You do not have to pull it completely out with each insertion. You can just pull it back about halfway. You may feel some resistance as the cleaning rod goes around the bend. Squirt 2 more cc's of normal saline solution down the catheter and reconnect the scoop oxygen hose to your scoop catheter. Wash and store the cleaning rod in a clean, dry place. Again, remember not to stretch the tip of the cleaning rod, but just to pat it dry. The original packaging from your catheter is a good place to do this. You can place a 2x2 or a 4x4 gauze under the flange if necessary, as you may have some drainage around the tract for the first few days. It is a very good idea to place a small strip of tape on both sides of the scoop flange over the bead chain necklace for added security. The tape can be plastic, paper, or a stretchy tape such as Tegaderm or Duoderm. This ensures both patient comfort and extra security, especially at night. It is only necessary during the 2 to 3 weeks following your procedure. This may have already been done for you when you were discharged from the hospital. You should be aware that the opening of your tract is a bit bigger than the catheter that has been inserted. You may have noticed some difficulty in speaking due to air escaping around the catheter. This is normal and will generally resolve over a few days. This is variable from patient to patient, but be assured it will get better over time and finally go away completely. You can place your finger or hand over the catheter site and apply gentle pressure on the flange when speaking, should you feel the need. Small streaks of blood in your sputum can also be expected for the first few days. This is normal and nothing you should be worried about. Cleaning your catheter twice a day or more is vitally important to the management of mucus. Since initially, the catheter acts as a foreign body in your windpipe, it is common to have more mucus than usual for the first few weeks. It is also common to have a tickle cough following the procedure due to the irritation caused by the catheter itself. Normally, your windpipe will adjust to the foreign body in just a few days, but it may take longer in certain patients. If you have a cough that does not steadily improve, make sure a transtracheal team member knows of the situation. In rare instances, a catheter of different length may be indicated. For these and other reasons, you will normally be seen at least twice a week for the first 2 to 3 weeks following your procedure. Mucus management is probably the most important element that your SCOOP team members are concerned with during the first few weeks following the procedure. Strict attention to cleaning protocols will help prevent or at least minimize the formation of mucus balls. It is very important that you understand what a mucus ball is and what to do if you suspect you may be having problems with mucus ball development. A mucus ball is a small collection of mucus that sticks to the outside of the catheter near the tip. It is not dislodged by the saline and cleaning rod when you clean in place. It will cause you to cough more than usual and may make your breathing more difficult. You may well cough up a pea to marble-sized chunk of mucus on your own from time to time. If this is the case, you should make sure you mention this at your next scheduled visit. Your doctor, therapist, or nurse will want to monitor the situation very closely, as it may mean you need to clean more frequently or a change in your humidification equipment may be considered. If you find you are having difficulty coughing out mucus balls on your own, you must be seen by a transtracheal team member. He or she will ask you to come in for a catheter stripping. This is a routine procedure done by a team member to strip any mucus that may be adhering to the catheter. If indeed you are having ongoing problems with mucus balls, your cleaning regimen will probably be increased, and you may be advised to consider a more sophisticated humidifier that provides heated humidification. All transtracheal patients must have at least a bubble humidifier on their stationary oxygen source, regardless of flow rate. Your oxygen saturation will always be monitored and spot-checked during every post-op visit. Additionally, your physician will probably tell you to go to your pharmacy and purchase an over-the-counter drug called Mucinex. Mucinex is an excellent drug that works to thin out your mucus and make it less sticky. It has a significant ability to reduce problems with mucus sticking to the catheter, thereby minimizing mucus ball formation. The correct dosage is 1,200 milligrams twice a day for a total of 2,400 milligrams. If your pharmacy offers the generic form of Mucinex called guaifenesin, you may certainly substitute that as long as you take the proper dosage. The importance of proper cleaning in place technique, adequate humidification, and prescription of Mucinex and guaifenesin cannot be overestimated. The 2 to 3 week post-procedure period requires diligence and strict attention to detail regarding the cleaning and maintenance of your SCOOP catheter. When your tract is sufficiently healed, you will be taught to remove one catheter and reinsert another on a daily basis. Mucus balls, and indeed most problems with mucus management, virtually disappear at this point, as you will be, in effect, stripping your own catheter at home on a scheduled basis. Your surgeon and transtracheal team will help you determine when your tract is fully healed. This normally takes between 10 and 14 days, but may vary in certain patients. At that time, you will be taught how to remove your catheter and reinsert another catheter for cleaning. As stated earlier, this will strip any mucus that may have accumulated on your catheter since your last cleaning. As with cleaning in place, It is always easier to assemble your cleaning supplies in advance. This time, your normal saline solution is optional, as you will not be cleaning the inside of your catheter. Many patients do prefer to clean their catheter in place to loosen any mucus before removing their catheter. You will need a second scoop catheter at this time. It may be easier for you to place your bead chain necklace through the holes on the flange before you perform the exchange. Arrange your oxygen to arrive from behind at your prescribed nasal cannula flow rate. Wash your hands with soap and warm water. Use a Q-tip and water to clean any mucus crust from the skin around the catheter. Apply a small amount of water-soluble jelly, such as KY jelly, to the tip of the clean catheter. Disconnect the bead chain necklace and scoop hose from the catheter. Remove the first catheter from the tract opening. The catheter should only be out momentarily. Insert the clean catheter. Place the tip of the catheter into the tract opening and gently push the catheter straight back. If resistance is met, twirl the catheter as it is inserted. Do not try to direct the catheter downward. The catheter will direct itself. It is quite normal to experience a tickle cough as the catheter enters your windpipe. Reconnect the bead chain necklace. Make sure you have a good 2-finger fit. When your scoop catheter is properly inserted, the scoop label on the catheter flange will be upright and readable. If you cannot insert your catheter within 5 minutes, call your doctor immediately and put your nasal cannula back on at your prescribed flow rate. Reconnect your scoop oxygen hose. You have now completed the exchange procedure. Now you must clean the soil catheter. Start by cleaning any mucus from the catheter tip with plain warm water. Use an antibacterial soap to disinfect the catheter. Run the cleaning rod through the inside of the catheter several times. Rinse the catheter inside and out thoroughly to remove all soap residue and blot the catheter dry with a paper towel. Finally, store your scoop catheter and cleaning rod in its original package in a clean, dry place and out of direct sunlight. Do not ever try to boil the catheter or place it in water over 120 degrees. If the water is too hot for your hands, it is too hot for your scoop. Never soak your catheter in any disinfecting solution. Your scoop catheters and hose must be routinely replaced every 90 days. Longer use of the catheter may result in the catheter becoming stiff or brittle. This can lead to chronic tract problems or discomfort. Your home oxygen company is responsible for supplying you with replacement catheters. Make sure they know as soon as possible that you are now a transtracheal patient, as your equipment needs may change significantly. A few other reminders to make your scoop experience more enjoyable and comfortable. The scoop hose that connects your catheter to your oxygen source comes in 9 different sizes to fit all patients. Your respiratory therapist or nurse can help you determine which size fits you best. Remember that the hose is designed to be worn on the right side. This ensures maximum comfort and prevents inadvertent kinking of your hose. In a rare patient, it is possible that the dissolvable stitches do not dissolve correctly. This may cause itching or pain. If you think this is happening to you, consult the surgeon who did your procedure. Treat your scoop like a lifeline. Although it is not truly life support, it is certainly supporting your life. This video was created to help you with the care and maintenance of your scoop catheter. In conjunction with your Scoop Patient Handbook, you now have all the information you need to get started. If you have any further questions or concerns, be sure to communicate them with your physician or other Scoop team member. It is our most sincere hope that now that you have been scooped, you will receive all the benefits Scoop Oxygen Therapy can bring, including a longer, healthier, and happier life.